Hello everyone and thank you for watching. Today I'll be presenting our study Indian Physicians' Attitudes and Practice regarding menopause and its management. I am Shraddha Namjoshi, a doctoral research scholar at the Department of Liberal Arts in IIT Hyderabad. I'm working with Professor Chittem and my areas of research interest are pediatric healthcare, psycho-oncology, cancer communication, endocrine disorders, and chronic diseases. So this research study was published with Menopause, the Journal of the North American Menopause Society, and it was led by Dr. Lathia, Dr. Selvan, along with myself, Dr. Chawak, Dr. Kelada, and Professor Chittem. So why did we do this study? The Indian Menopause Society published clinical guidelines in 2019 and 2020 that endorse menopause hormone therapy for eligible women alongside counseling, patient-centered communication, and shared decision making. But those guidelines don't actually address the communication skills training that physicians would need to deliver on any of that. And most Indian research on menopause is focused on the women themselves, their symptoms and experiences, but not on the physicians who are managing them or working with these patients. So when we looked for prior work on physicians' perspectives, we found only two studies, both quantitative and both limited to female participants only in India. That left the male physicians' views and really the nuance behind any of the numbers completely unexplored. So our aim was to qualitatively explore both male and female Indian physicians' attitudes and practices toward menopause to help inform future training and decision aids. So for this study, we chose a qualitative focus group design, and I would like to explain why. We purposely recruited 10 physicians, 6 women and 4 men, with a mean age of 51 and a half across endocrinology, gynecology, OBGYN, and reproductive endocrinology. We deliberately balanced the sample for specialization, gender, and age. Recruitment reflected how Indian professionals often communicate. Physicians were invited through a professional network and consent was obtained over the phone, which many participants found more natural than email. We then held a 40-minute semi-structured focus group over Zoom since this was during the COVID-19 pandemic and it was moderated by two researchers who were trained in qualitative health methods. Our analysis used qualitative content analysis with two independent coders and very strong inter-rater agreement. So the coherence kappa between 0.75 and 0.86 across all three themes was obtained, and we followed the coded guidelines when reporting this particular study for publication. Why this design? Because prior Indian studies were quantitative and women only, so a qualitative mixed gender focus group filled both of those gaps in one study. The focus groups would also allow physicians to build on each other's experiences, give their expert opinions, and this would bring up nuance that a survey or independent interviews simply could not capture. So, three themes were extracted. The first was attitude towards menopause, and it was captured with the phrase, the only way to get over it is to accept it. So, physicians consistently describe menopause as a natural, unavoidable phase, something that women should accept quickly for an easier transition. And notably, improving one's own knowledge and well being during menopause was framed as clearly the patient's responsibility, quote unquote, not something that physicians felt they needed to initiate. Physicians also observed that rising awareness has shifted patient expectations. So, women now want quality of life solutions, not just symptom management. And some physicians felt that this expectation was unfairly placed on them. Interestingly, female physicians in particular encourage patients to seek out information broadly, even from unverified sources like social media. In the second theme, we talked about physiological and psychological symptom management, which is captured through the quote, more than hormone therapy, it is empathy that's required. So views on menopausal hormone therapy or MHT were genuinely mixed. Younger physicians in their mid to late 30s felt very confident prescribing it early. Others remained cautious, citing that the Women's Health Initiative study and the lack of clear national protocols made them more cautious while prescribing MHT. So they tended to prescribe hormone therapy only as a last resort once the patient was in significant distress. Regardless of their views on hormone therapy, though, every physician in our group routinely recommended alternative approaches, traditional Indian treatments, meditation, stress reduction, either alongside or instead of hormone therapy. And across the board, physicians described empathy, active listening, and psychoeducation as central to how they wanted to support distressed patients. Finally, they wanted to match empathic intent with skills. So, in the third theme, we looked at the gap between the physician's good intentions and their actual practice. Physicians told us that they typically waited for patients to raise the menopause issue themselves rather than opening the conversation proactively. When we asked why, they said they lacked a way to measure symptom severity, which was notable because a validated tool, the menopause rating scale, already exists and is used both internationally and within India. Physicians also openly acknowledged gaps in their own training. One described it simply as our basics are not clear, and when asked what they needed, physicians named four clear priorities. They needed screening, early identification, medical management, and communication skills. So, how do we interpret all of this? We interpret it as a guideline practice gap. Firstly, framing menopause purely around acceptance and placing responsibility on the patient may actually reflect physicians feeling underprepared to address the psychological side themselves. Second, hesitancy around hormone therapy seems to lag behind current guidance. Physicians' caution still seems rooted in the older WHI findings, even though the 2019-20 Indian Menopause Society guidelines offer much clearer and more reassuring recommendations. And third, and I think this is one of our more interesting findings, the barrier around screening tools isn't that no tool exists, it's that physicians simply aren't aware that the menopause rating scale is already in use. This is a dissemination gap, not a genuine absence of a solution. As with any study, there are strengths and limitations to keep in mind. Firstly, this is one of the first qualitative Indian studies to include both male and female physicians' perspectives, and diversity across age, gender, and specializations gave us a genuinely broad range of views. Having a physician lead the discussion also helped participants speak more candidly, and our interpretive reliability was very strong across all three themes. That said, we had a small sample, so this is more exploratory work rather than something we can generalize extensively from. We didn't examine patients' own perspectives in this particular study, the virtual format, which was necessitated by the COVID-19 pandemic, limited the non-verbal and in-person data aspects that we could have gathered. And a complementary quantitative study, which was underway at the time of writing, is not yet available, but we are working on it. So where does this take us? Four key priorities emerge. First, we need to actively disseminate the current guidelines through menopause societies, continuing medical education, and public health channels so that physicians are working from up to date information. Second, we need structured communication skills training, symptom checklists, standardized distress screening tools, empathic communication techniques, and clear referral pathways to psychologists. Third, menopause care needs to be embedded properly into medical education at both the undergraduate and postgraduate level, addressing the very gap that physicians told us about directly. And finally, these findings are already feeding into a larger research program, one aimed at developing communication skills training and decision aids for Indian physicians and the women they care for. In short, Indian physicians want to help their patients through menopause with empathy, but many feel that they are missing the skills, tools, and up to date guidance to do it proactively and with confidence. And this is the gap that our future research or other development work needs to focus on. This is an actual screenshot of the published article. and a link is provided in the description box below. So please feel free to click on that and explore. I'd like to thank the Health Associated Cooperative and Supportive Group HACOS, which is the research group that carries out all of our activities. And we are a group of research scholars who work on psycho-oncology, psychosocial diabetes care, chronic kidney disease, pediatric diseases, women's health, including endocrinological health, and behavioral health, as well as psychosocial aspects of mental health. Thank you all very much. We look forward to presenting more of our work on this platform. Thank you for listening.